Hello, everybody on Instagram and on Facebook. I'm here today with my dear friend, Dr. Alan Christensen, a longtime collaborator of mine. We're going to be talking about the low iodine approach to thyroid health. I'm so excited to have this conversation today with Dr. Christensen. This is something, if you are watching it live, you can actually ask questions because this is a sneak preview of my podcast that's coming out next month, Thyroid Pharmacist Healing Conversations podcast. So let us know if you're watching. Let us know if you're here. Please say something in the comments so we know that the technology is working, because sometimes it does not, and it makes us a little bit nervous. But I will do a little bit of an introduction, and then we'll welcome Dr. Christensen in. So welcome to the Thyroid Pharmacist Healing Conversations podcast. I'm your host, Dr. Izabella Wentz, and today I have a very special guest joining me, a longtime collaborator and colleague of mine, Dr. Alan Christensen, and we're going to be talking about the low iodine approach to thyroid health. I'm going to give you a little bit more information about Dr. Alan Christensen. He is a board-certified naturopathic endocrinologist specializing in thyroid health, a New York Times best-selling author. His works include The Hormone Healing Cookbook and The Thyroid Reset Diet. Dr. Christensen was the founding president behind the Endocrine Association of Naturopathic Physicians and has trained thousands of doctors worldwide in natural thyroid care. He frequently appears on major national TV shows such as Dr. Oz, The Doctors, and The Today Show, and his expertise has been featured in publications like Women's World and Natural Health. Such an honor to have you here again with me, Dr. Christensen. I always love collaborating with you. Welcome to the show.
Thank you so much for having me, Dr. Wentz. Again, any excuse to hang out and be with you, and I love everything you do and glad to be with you.
Likewise. You don't talk about your unicycling in this new bio. I want to know what happened.
Yeah, I'm not sure why they went by the wayside, but that's, one of the hobbies has been off-road unicycling, which is a lot of fun and not very common.
Well, I know that you and your wife moved to Minnesota lately, and you've been enjoying living a different lifestyle than you have been living in Arizona for so long.
You know, it was funny. Last week it was about 20 below, and now it's about almost 40. So the temperature changes a lot pretty fast. But yeah, I'm from up here, and I missed being in the woods, just looking out the window and seeing the lake, and bald eagles go by and all the trees around. And yeah, it's very, very restful and restorative.
I love following you on social media, and you always show like the scenery where you live, and it's just so gorgeous and peaceful. And I don't think a lot of people know about your history or how you actually became interested in naturopathic medicine. I know if people that follow you, they see you as like super vibrant and very athletic and, obviously very fit and knowledgeable, but you actually had a lot of health challenges when you were a kid, right?
I did. Yeah, I was adopted. My birth mother was not healthy, not in a very good place in her life, pretty young. Wonderful farm family in northern Minnesota took me in, but I was epileptic and I had some degree of cerebral palsy, so very uncoordinated, and yeah, really couldn't do a lot of sports or activities. And somehow or other, between that and just the struggles of life, I got really heavy as an adolescent. I was very obese, and so it was I really felt, now we talk about fat shaming. Back in the 70s, we didn't. It was just normal. It wasn't as common. So there weren't as many people who were big. But yeah, I really felt social ostracism during the time in life in which the social world becomes so important. And I was a bookish kid, and it kind of drove me into trying to figure out how to get healthier by reading books. And it was a lot to sort out, and nothing was easy or work at the first go. But over time, I was able to gradually become more active and lose some weight and overcome a lot of issues. And it just left such an impression because I knew that how life-changing it was for me and how much it meant to me. And I had seen doctors, and they meant well, but nothing really helped in the ways that I wanted. And I thought, well, what's the deal? As a kid, I could find things in books that changed my life like this. And, how many people must be really held back or not living the way they want to for reasons that don't have to be, for just simple facts lying around they don't have access to. And that's what really just lit the fire.
Yeah, it's amazing that you share that because I feel like some people, maybe they're listening or they're thinking it in their head, well, like, I don't know that I could ever be helped because I was born with this, or I have this, or, I'm struggling with my weight, and other people don't know what it's like to struggle. But you've been there and you've come to the other side. And I feel like it's made you so much more compassionate in helping people with thyroid issues.
And that's the thing. As I was in my medical studies, I knew I wanted to go into medicine, and I knew that diet, lifestyle were super important. So I chose a career that allowed for that. And early along, I saw that those with thyroid disease, they were doing a lot of the things that seemed like they should make sense in terms of eating well and being active, but it wasn't working for them. It wasn't enough for them. And I saw really conflicting messages they were hearing from the conventional approach, a lot of different alternative approaches. And I connected with that. I thought there's got to be something where there's some parts of these things have to be real and some parts are working better than others. And it got me going on that 30 years ago. And it's been just a passion ever since.
And it was kind of funny, but I was living in Scottsdale when I started experiencing some thyroid symptoms. And your clinic was like down the road from where I used to live. I was only there for a year, but it was like that year. And I'm like, oh my gosh, had I known about you earlier on my healing journey, that would have changed the trajectory of my health so much. I wouldn't have had to like figure out so much stuff on my own. And I really appreciate everything you do to educate people. You've written, in addition to having a clinic for so many years, you've written a lot of books on your experience over the years working with thyroid patients. And I know, just as I have, your philosophies have perhaps evolved a little bit with time.
Yeah.
I know when we first met and we first collaborated, we were talking about, I was really passionate about gut health, and I'm still passionate about gut health. And you were really passionate about optimizing thyroid hormones. And the way that you were doing that was a lot of times through natural desiccated thyroid. And this was like really a big area of focus for you when we first met, was like really optimizing people through using natural desiccated thyroid. And then I know you had published a book about adrenals, and you were like, okay, this is another approach. And then the thyroid reset diet, or then the metabolism reset diet. And throughout the process, I've focused on the adrenals and nutrition and all these things. And I feel like our theories, the more we research and the more we work with clients or patients, the more we see some of our theories really start to evolve. And I know you were never like necessarily in like the high iodine of hypothyroidism, but you really took something, you like have this really, really unique approach that's focused on not like low iodine and how that can actually restore thyroid health. Can you tell us a little bit more about perhaps how you got there and how you started, what made you really focus on iodine?
Yeah, great question. I think about, I guess, my journey with iodine in like 3 stages. So the first one was a doctor with a nutrition background, knowing what it did and the basic stuff and stuff like that, and about that. And then knowing it was used in a lot of other ways, effective antiseptic, used for wounds, could also be an expectorant, used as contrast. So I knew the basic stuff, right? That was stage 1. Stage 2, this one started, it was fascinating. I practiced in Arizona for so long, and a lot of my patients were seasonal. They would be there. I was their doctor for half of the year, and they had another doctor for the other half of the year commonly. And so one gentleman, he was mid 70s and someone who was like an aspirational health model for me. He was really involved and just did everything exactly right and super, super fit, amazingly healthy guy. And he comes back one year after being away, and now he has toxic nodular goiter. And it was kind of odd. In my head, I knew that in that age and demographic, that wasn't common. But when it did happen, it was often after high dose iodine exposure. I knew he'd had some back issues, so I thought he must have had an MRI with contrast. And so I jumped to his back. I said, well, what happened with the back? He goes, no, there was no MRI. Like, well, were you exposed to iodine? Is that how this happened? And so basically, that's when I was first exposed to this new model that was hitting natural medicine, pushing for megadose iodine. So that started stage 2. And stage 2, I went deep into that, reading it, looking at all the papers that were out, all the popular stuff, and saw that, it wasn't safe. So yeah, that's kind of how that second stage started. And the third stage is realizing that for many, there's also an opportunity in reducing it.
Yeah, it's very, very fascinating. And I feel like iodine is a very controversial nutrient in the thyroid world because our thyroid gland needs iodine to produce thyroid hormone. And so when you kind of glance at it on paper, it's like you're low in thyroid hormone. Let's give you more iodine. And that that equation checks out on paper, right?
Sure.
But when we start, and we know that people in iodine deficient areas have higher rates of iodine induced hypothyroidism or iodine deficiency induced hypothyroidism. So I feel like that checks out, right? But then when you kind of start looking deeper and peeling back the layers, you start realizing that, okay, so yes, you can have iodine deficiency, which can lead to hypothyroidism, but actually, iodine is a narrow therapeutic index nutrient. So when you have too much of it, holy cow, this can be problematic too, because now in the countries that added iodine to their salt supplies, the rates of Hashimoto's are going double, triple, and quadruple compared to, the rates of Hashimoto's before iodine was added to the salt supply. Could you talk a little bit more about like this mechanism? And it's like, looking at it just straight up on paper, it's like, oh yeah, 1 + 1 = 2, but it doesn't necessarily work that way, right?
Yeah, and that's the thing. I guess we're quick to think about things in our diet or nutrients or interventions as good or bad, and I'd really like to encourage people to not do that. So good and bad, that can apply to storybook characters, not even grown-up stories because they're more complicated than that, but some of the most basic kid stories have good or bad characters. That's where good and bad should end. So I think about these things more like, I don't know, like musical notes. I mean, they're not good or bad. It's like, do they belong here? I mean, how long should they go on for? I mean, what should go around them? So they're more like that. But yeah, iodine's a really tricky one. Some of the things you mentioned about how when it was added in, the rates of Hashimoto's went up. There were some stats on that from the US. So we started fortifying about 1924. And there was never a federal mandate, but it was voluntary in a lot of areas. The famed Mayo Clinic is from southern Minnesota, and they were near the Great Lakes. So they were in areas where there was higher rates of thyroid enlargement due to low iodine in the soil. And coming up on World War I, a lot of possible soldiers weren't acceptable because they had goiters. So that prompted more thought on this. And the fortification, the decades afterwards, the rate of Hashimoto's in women in the classic ages of like 30s, 40s, and 50s, yeah, it went up 26-fold, not percent, but fold. It skyrocketed. The mechanism, it's a complicated thing. So most nutrients, I think about your blood kind of like soup, and you got stuff in the soup, and that's what your organs have to work with. And that's fine. But iodine's different because it works in such small amounts that your body has to control how much comes in. So you're not just swimming in soup, it's brought in selectively. And you pull it in or you block it out. And so because of that, when you get a little bit too much, you block it out. And the paradox is too much can cause a lot of identical problems as too little because you shut it all down.
Yeah, it's so fascinating that it works that way and it's not as straightforward. And we do know, definitely there are benefits to having iodine in our bodies, but like too much can be toxic. I think there's this saying, right? It's like if whether something is a toxin or a remedy depends on its dosage, right? And I know certain individuals are going to be at higher risk to iodine-induced thyroid dysfunction because for every time we say something, there's going to be somebody that's like, I take 500, I take a whole bottle of iodine and I look at me, I'm like, I feel amazing, right? And so who are the people that we're concerned with that they're perhaps overexposed to iodine and that it could be problematic in them?
Yeah, great questions. There's kind of like three thresholds to think about. There's requirements, there's tolerance, and there's toxicology. So how much you require pretty much is body size. There's not a lot of genetic variation. It's more predictable based upon just body size and age, and then also status of like pregnancy, non-pregnancy. Then there's toxicology, and that's mostly tied to renal function. So if someone has a compromise to their kidneys, they can't clear it as well, and it can damage their organs more easily. But then there's tolerance. That's to where when you're above your tolerance, it's not so much damaging organs, but it's really causing excess oxidative damage in the areas that it builds up, mostly within the thyroid. So genetically, there's a big range in tolerance. And thyroid disease, it's funny, we talk about different causes and like these long lists of causes. And I think about like causes and contributors is different. So a cause can make something happen all by itself. It needs no other factors. And if we think about a cause in that sense, it's been argued there's really only 4 causes of thyroid disease. There's genetics, age, gender, and then iodine exposure. And yeah, gender and genetics go together, and age is just these same glitches played out over longer periods of time. So many other things, if someone's prone to it and it's close to happening, countless things could make it more or less likely, the contributors. But causes, there's just a few. So the genetics, we think that humans are really adapted to 2 radically different types of iodine environments, coastal or inland. And coastally adapted humans, they had a lot of iodine often. A lot of seaweed, seafood in the diet were a big part of things. So they were very good at mechanisms to detoxify it. Now, inland adapted humans often had very sparse amounts. So they were very good at just holding on to every speck and concentrating it. But you can't be good at saving every speck and then also detoxifying it. You kind of pick or choose. And with thyroid disease, nearly all types, it comes down to variations of about 12.5 different genetic SNPs. And these SNPs are primarily ones correlated with iodine metabolism, with different activity of D-iodinase enzymes. So people are basically inland adapted or coastally adapted. And the inland adapted people now, if they're exposed to amounts that aren't even all that crazy high, that may move them out of their range of tolerance.
That's really fascinating because I know so many people quote the Japanese.
Yeah.
They say, oh my gosh, how can this be unhealthy when the Japanese have so much iodine that they get through their diet and they're one of the more healthiest populations, right? What are your thoughts about that?
They're healthy in a lot of ways, but at the same time, it's not a coincidence that it was a Japanese doctor who first identified autoimmune thyroid disease. And kind of a cool thing, first identification of autoimmune disease in general. So Dr. Hikaru Hashimoto wrote a big paper back in 1907, and he saw that people with unexplained thyroid problems, when he analyzed their thyroid tissue under a microscope, it was full of immune cells, full of lymphocytes. And he realized somehow these lymphocytes were being driven in. So Japanese often do have good longevity, lower rates of many conditions, but they have the highest rates of all versions of thyroid disease globally. And they do have genetic adaptations to higher amounts. But even with that, they have higher rates of thyroid disease.
Thank you so much for sharing that. So for anybody listening, yes, the Japanese do have higher rates of Hashimoto's, and Dr. Hashimoto himself was Japanese, right? I really appreciate you sharing that because I feel like a lot of people that talk about that really miss that small, minute detail of the higher rates of Hashimoto's in that population. As far as, I guess, what might be the signs that somebody is consuming too much iodine and what might be the consequences for people beyond, or maybe you can just tell us, what are the consequences of having too much iodine?
Well, so too much back at that toxicology level, not very common, but that can even be fatal. Back when all the old medicine bottles with the skull and crossbones on those, that was because iodine was one of the more popular means of suicide in the 18th century. So yeah, way too much is fatal, but that's not common. Not many cases of that occur anymore. So too much in terms of intolerance, not toxicology, but intolerance, the first things to really go wrong are thyroid problems. And that can be thyroid autoimmunity, changes in thyroid output. When someone is having thyroid autoimmunity, they're looking at most commonly a couple of the relevant antibodies. They're anti-thyroid peroxidase or anti-thyroglobulin. And it's worth realizing that thyroid peroxidase, its job is to oxidize inactive iodide into more active iodine. And then thyroglobulin is a protein where it's stored. So when someone is above their personal tolerance, there's more iodine than thyroglobulin has room to store within the thyroid. And now this free radical damage pulls in the immune cells. They start attacking things, and soon they're attacking thyroglobulin and thyroid peroxidase.
It's really, really fascinating. That was one of the first things I really wanted to unravel when I was trying to heal myself with Hashimoto's was high iodine. And do I do high iodine? Do I do low iodine? Do I do just the right amount? And I came across some researchers who were limiting people's iodine intake, and they actually saw like really significant improvements in thyroid function, where the other things I had seen too were people who are using high dose iodine. A lot of times I've seen personally in my clients where they'll be like subclinical hypothyroid, maybe antibodies in the 200 range or something like that. And their thyroid antibodies like jump up really high, their TSH jumps up high. And maybe they were like more fatigued before, but all of a sudden they're like, I was bedridden because of this high dose iodine. So I think it's really important to just be mindful of what this can do from excess iodine. As far as the low iodine approach, what do you see in your clients and patients that go on a low iodine protocol? Do they feel better? Do they reduce their thyroid antibodies? Does their TSH normalize? I would love for you to provide some of the results that you're seeing in your clients, because you've been doing this for quite a few years now. And I know I saw some research studies about it a while ago, but I've only had maybe a handful of people that I've put on the low iodine protocol. So I'm excited to learn more.
Yeah, nothing works 100% of the time for everyone. One of the larger controlled studies showed that of those who were compliant with the approach, that roughly 78% could reverse overt hypothyroidism, average TSH scores of 14, within about 3 months when they were positive with antibodies. And some were not compliant, some weren't following it well, and some improved but didn't reverse all the way. So if you rephrase that one to say, of those who were compliant, how many radically reversed or improved a lot? And that was a little over 95%. So I've seen numbers that have been very positive. I haven't put hard numbers on those that I've interacted with. And it's always tough because we can always see biased populations. There might be those that have tried things and found other things more helpful and really never interacted with me. But I've had every week I'll hear dozens of people who reach out and send cards or send messages saying that, yeah, I now have been totally cured. Someone a couple of days ago sent in a note. She had a TSH of 46 or 40, I think it was 46. And she had very high antibodies in the hundreds, not in the thousands, for antithyroid peroxidase. I think in the 30s for antithyroglobulin. And I'm kind of surprised many are put on medicines more quickly in situations like that, but she wished not to. She wished to forego. And it was about 2 months of following the approach, and she saw that her TSH normalized. It came down that quickly, which was a pretty quick response. So that was good. And again, not everything works for everyone, but I see these things just all the time. And then many who are on medication, often there's a little more involved, because sometimes even if your body no longer needs the medicine, it does take reducing it in a cautious way to see that really play out. But I also see many who they no longer need medication as well. And this is something I love you talk about, how our views have evolved. The way mine has evolved, I think the most is that I'm more optimistic than I've ever been before about how likely the body is to recover.
Well, I remember back in the day, you were very much like, not that everybody should be on thyroid medication, but you were like a very big proponent of thyroid medication. And for you to come out and say you can actually get off of thyroid medication or may not need them, like, I just want people to understand what a big deal this is for you to actually say this, because you're so experienced in working with all of the different thyroid medications and you've done it for so long with so many patients that this is a big deal. It's not like some crazy person off the street that's like, you might not need medication. So this is actually something that you have seen as a naturopathic doctor.
To expand upon that, for the first decade or so of practice, I didn't really see many examples of people who were on medicines and then no longer needed them, or where they had significantly abnormal levels and were able to correct those without medication. I really didn't see that. And I saw people trying all sorts of things. I was recommending many things. I wasn't seeing consistent benefits. And probably the single question I heard the most from people was, that they were on medication was, could I get off? Could I stop someday? And I would encourage people to focus more upon their health, their function, how they were feeling, and working to feel their best, and put less focus on which pills they were taking. Because honestly, I really didn't have great answers. I didn't see things that worked consistently. So yes, that's been a big shift.
Yeah, it's just really exciting to be in this day and age, because I feel like, 10 years ago when we met, there weren't a lot of these resources. And now we have the low iodine approach. I know research on selenium and myo-inositol has come out for subclinical hypothyroidism. And I've seen a lot of people having success with that, as well as the red light, low level laser therapy over the thyroid gland. So it's exciting that we can share these innovative things that can be very, very helpful. Going back for a minute here, what exactly is high dose iodine versus low dose iodine? This is a question that people always ask, and I would love to know if you have defined that for people. Like, how do you know what amount is going to be problematic for an individual with maybe Hashimoto's antibodies and thyroid symptoms that has an elevated TSH?
Well, we got to think about the global intake, one's global intake. It's kind of funny. I talked to someone recently who was saying that whenever they ate protein, they gained weight. I'm like, well, it's like you're packing a suitcase. A sweater can fit in a suitcase, but not if there's 10 pairs of pants in there already. So yes, it's protein's like that in the diet, and iodine's like that too. So it's not that any one thing is the deal breaker. It's how much you got in the suitcase, right? It's how much is there from all sources coming in. And there's been a lot of work done on this. Honestly, more than any other nutrient, we've tracked iodine's correlation with diseases, with thyroid disease. We have more data on this than vitamin C or any other nutrient. So many populations have been tracked during, before, and after changes to their iodine intake. And there's a pretty clear threshold to where thyroid disease starts to emerge. The higher a population exceeds above about 200 micrograms per day. Now, there are those who really are not prone to thyroid disease, and they can likely have short-term exposure to about 1,100 micrograms without a lot of harm. The World Health Organization has identified that. But those prone to thyroid disease, the more they get above 200, the more likely they are to be at risk. And it's funny, we talk about a population's level, and it's really an average. There's a dumb joke about a statistician who had his head in an oven and his feet in an ice bucket, and he was at an average of 72 degrees, So in the US, the last big survey showed that if you break it down by age, gender, ethnicity, they're all a little different, but somewhere around 30 to 40% of the population at a given point in time is exceeding 200 micrograms per day. And if they happen to have these genetic variations making them prone to thyroid disease, that can be a problem.
I looked into, when I was doing research for my book, The Hashimoto's the Root Cause, I looked at the iodine levels in foods, right? And so we know things like seaweed snacks, iodized salt are some of the highest for iodine content. What are some of the other foods that may contain iodine or higher levels of iodine?
It's really weird. Yeah, it's hard to get good data. There have been several large NHANES studies on iodine that have been done, looking at different parts of the country, different sources repeatedly. Basically, I found about 638 foods and about 50 samples per food that I analyzed when I wrote the Thyroid Reset Diet. And what I saw was that there's some foods that consistently have pretty safe amounts. Nothing has none. Some foods have very consistent safe amounts. Some foods consistently have moderate amounts. And then some foods always have a lot or sometimes have a lot, right? And some things you mentioned, seaweed snacks, iodized salt, not really a big surprise for most. But there are a couple of weird outliers. Something I saw that was really made me curious. There's so many people who have done better when they've gone gluten-free and dairy-free. Totally true. No debate about that. Your audience has shown that. And when I look back at sources of iodine in the diet, the most common sources don't have much more iodine than they've had in the past, and we're not eating much more of them than we have in the past, with the exception of processed grains and dairy. Those are two things that people now eat more than they have in prior decades, and the amount of iodine in those foods can have much more than it's had in the past. So those are often very big sources people don't think about.
That's really interesting because I feel like there's so much research going on why bread might be problematic. And then for people with celiac disease, which is more common in Hashimoto's, then it could be the gluten component. For people with SIBO, which 50% of Hashimoto's individuals might have, it could be the FODMAP component. And it could also be like, a whole bunch of other things, but iodine could also play a role in this as well. And with dairy, we thought it was, casein or whey that were problematic, but it could also be the iodine component of dairy, why that can be triggering for so many people. So that's a fascinating point to consider. Now, this is something that you really opened my eyes to, but it's not just food. So I thought like all of the iodine that we were intaking came from our food, but it's not just our food that can contain iodine, right? Can you tell us more about the other places it might be lurking?
Yeah, I guess salt kind of goes in food sometimes or not, but yeah, so salt can have it fortified and it can be naturally occurring. Oddly, there's many salts that have a lot, yet their label says this salt does not supply iodine, an essential nutrient. So that can happen. That's a tricky one. Supplements. And iodine is something that's extremely chemically reactive. And that's why it's useful. That's why it's an antiseptic. We think about like bleach or peroxide or iodine in the same vein. But because it's reactive, it can be very unpredictable and very unstable. So when in supplements, it almost never has the labeled amounts. There was one about 3 years ago, it was an assay of the iodine content in prenatal vitamins. And it looked at 120 different products. And what it saw was that exactly 0 of the products were within 10% of the labeled amounts. And many had 3 or 4-fold above the labeled amounts. So yeah, a basal dietary intake, it's hard to get lower than about like 100 micrograms, even if you're deliberate. So if you think about 200 as a target for general safety, and then if there's more coming in from supplements, it's very hard to get on track. And then the other big category is personal care products. So iodine does absorb across intact skin, or of course also mucous membranes or damaged skin. And prior to 2018, many hand sanitizers contained iodine as part of their sanitizing agents. Well, it was noticed that hospital workers were being exposed to unsafe amounts and having higher rates of thyroid issues accordingly. And so it was banned from hand sanitizers then. And many parts of the world have banned it from other personal care products. We've not. It's a useful molecule. It's an antiseptic. It makes creams not separate. It makes things not get the wrong color. It does a lot of really useful stuff, but we absorb it. And the amounts that affect us are so minuscule. So I did the math on one of my wife's conditioners. I took her conditioner and I pumped it as directed, and I weighed that, and it was about 20 grams. Well, it's like 20 million micrograms. So many conditioners will have polyvinyl pyridone, also called PVP. There's a few other names for that. Now, if you buy natural cosmetics, you won't have that. You'll have kelp extract, but it's the same thing. Or you have, sea vegetable extract. It's the same thing. And that can make up maybe 1 or 3% of the formulation. Not a lot, right? Well, PVP is about 12% iodine, and about 4% of that is absorbed across intact skin. So you take that 20 million times the 1%, times the 12%, times the 4%, and you've still got over 1,000 micrograms that might enter your bloodstream from one personal care product.
Yeah, that really opened up my eyes when you told me about that there could be iodine in our personal care products. And as a pharmacologist, the thing about topical skin application, it bypasses the liver. So usually if you take something orally, like the liver kind of works on it and you might not absorb as much of it. But when you absorb it in the skin, you don't have that first pass effect. So you can really, I think people don't really appreciate like how impactful topical application. So, you're putting on lotion or you're putting deep conditioner into your hair and that's absorbing through your scalp. that can be quite impactful. I think you mentioned some of the ingredients we should be on the lookout for, like kelp extract. Are there any others to be looking out for? I typically recommend, clean hair and skin products, and I'm wondering if this might be one of the reasons why people feel better with clean skincare.
Probably. There's actually a lot of different names for PVP, but they're all some version of PVP, which is iodine is basically a lotion stabilizer.
Yeah. Yeah, thank you. Thank you for sharing that. I think that's hugely eye-opening. You also talked about prenatal vitamins. And now I know a big concern for me is women of childbearing age and making sure that they are adequately supported through their pregnancy, postpartum period. We do know that thyroid disorders are more common in the postpartum period, and that also women with thyroid disorders are at higher risk for miscarriage and having pregnancy complications and so on and so forth. And so the RDA for pregnant women for iodine is going to be higher. And I want to give some reassurance perhaps to women in their childbearing ages, like what should they be doing? Because if you have Hashimoto's and high thyroid antibodies, what do you do about your prenatal?
Yeah. A big question too that's kind of categorizes what someone would need to do is whether they're on thyroid medication. So when they are on thyroid medication, they're meeting a great deal of iodine intake from that also. So that's also worth taking into account. But yeah, those who are not on thyroid medication and are pregnant, iodine's, and again, this is not, it's not the bad guy. It's not a bad thing. We need it. It's life affirming. It's the basis of a lot of life. The amounts are higher during pregnancy. The recent papers coming out have shown that the requirements are higher, not as much as we thought in the past. So current guidelines suggest somewhere around like that 100 to 300 micrograms being a good reasonable target. But above that, we'll see a lot of these same issues emerge. And kind of surprising, but the American College of Gynecology, the American Academy of Clinical Endocrinology, the American Thyroid Association, there's not clear guidelines recommending iodine extra intake for pregnant women, believe it or not. And they've shown that iodine supplements during pregnancy, they correlate with higher rates of thyroid antibodies, greater rates of morning sickness, but they do not correlate with better health outcomes for the mother or the baby. There was a large Cochrane review done about that recently, and those are some of the conclusions they showed.
That's very interesting. And I would say, kind of as a caveat to that, like for women that are in their trying to become pregnant or pregnant, like this is probably not the time to think about like weaning off of thyroid meds, right? Like
Exactly.
the research does show that thyroid medications with thyroid antibodies and, we have better pregnancy outcomes when we have our TSH optimized, and utilizing low dose thyroid meds can help with pregnancy outcomes and fertility and so on and so forth. So would you agree with that, or what's your take on that?
I've watched that literature pretty closely. I'll back up one more step about what I was saying before about during pregnancy. So I broke down foods into the lower, moderate, higher iodine source. So during pregnancy, I encourage 1 or 2 servings of moderate intake per day from foods. That's the best way to get stable amounts. And there's lots of good options that way. Yeah, as far as thyroid and pregnancy and levels, I've watched that literature very closely, and it's evolved quite a bit. What we now know is that thyroid autoimmunity can affect pregnancy regardless of thyroid levels. And we also know that thyroid levels, even within the normal range, can affect fertility. So what we call subclinical hypo during pregnancy is different than the non-pregnant state. But the windows in which thyroid meds help are getting narrower. So we now know that subclinical disease in which TSH scores are abnormal, meds do help outcomes. Within the normal range, there's no longer consensus that meds help outcomes. Even though it's true that outcomes are better with a lower TSH, it's not yet clear that meds change that meds improve that. And it's also no longer thought to be the case that meds have benefit with normal thyroid levels and the antibodies being high, even though the antibodies do affect risks. So that window's narrowed a bit.
Yeah, I think it's interesting to keep an eye on the literature and as it evolves. I know for me personally, I'm comfortable with, like, if somebody is trying to get pregnant, I'm comfortable with telling them that they should probably optimize their thyroid hormone function if their TSH is elevated and if they have thyroid antibodies. And we'll kind of watch to see what more things evolve from that. But the other, I think, important nutrient that oftentimes goes hand in hand with iodine is selenium. And so that's another thing to consider, like not necessarily doing just one thing in isolation, is to make sure that you're balancing the book. So, looking at your ferritin levels, looking at your selenium level, considering a selenium supplement for pregnancy. If you could tell, I have like baby fever right now, can you? Can you tell? Is it that obvious? But I would love to actually talk a little bit more about the practicality of how do you get this low iodine approach for somebody who is perhaps thinking about, like, maybe they have subclinical hypothyroidism, or they have an elevated TSH, elevated thyroid antibodies, and they're like, okay, how do I implement this into my life? Like, how do I make it practical?
It's a really straightforward thing. The first step I encourage is just doing a quick inventory of personal care products. And I did a analysis of just top sellers and kind of went through a bunch of top sellers. My hunch is that about a quarter to a third of products do have iodine. So the flip side of that is most do not. And if one of your favorites does, you'll see a lot of good parallel swaps that do not. That's easy to work around. Once you know that, you kind of know that. So there's that. And then swapping out salt, doing versions of salt that don't have added iodine or don't have a lot of naturally occurring iodine. And that's super painless. You're not having to give up on salt, you're just changing the types. Then I think about really supplements, doing an inventory that way. And it's tough to get, so back up one more step. So if 200 micrograms, above that is where we start seeing problems emerge. It seems that reversing it is a short-term time frame of below 100 micrograms. So yes, going below 100 for some deliberate period of time is where most of that healing tends to occur. And with that target, again, even with being deliberately low in the diet, it's hard to get much lower than that. So everything else pushes you over. So that's where just being aware of it in supplements and avoiding makes a big difference. And there's thinking about the foods. And with the foods, there's so many great options. There's no major food categories one has to give up. And if someone is already gluten-free, that's easy. They're already cutting out on a lot of big sources. The same thing for dairy. And then also what we realize is that if someone is choosing to be paleo, autoimmune paleo, vegan, it's easy. But at the same time, there are ways in which if someone is cutting out things that often have a lot of iodine, they may be missing some categories by which they're still getting a lot. So taking what your diet is, if it's healthy, if it's specific in some way, and just being more specific about the iodine content. And not a hard thing. All food categories are still available with some workarounds. Fruits, vegetables, nuts, seeds, beans, animal proteins. These are things that really aren't big factors. So those don't really require limitation, but there's plenty to eat.
I think one of the things you had taught me about was the sea salt, and you had mentioned, you started talking about it, but I would love to get a little bit more clarity, because there's different colors of sea salt, and you might be able to tell by the colors as to their iodine content. Is that right?
Well, the more colors they have, the more impurities they have in general. That's what the colors are. So there's that. Some types of sea salt have had assays showing they're generally low. Some are higher than others. Pink Himalayan has had a few assays that have been contradictory, and not all have been the same. But some have shown amounts that are quite high. That has shown up. And that's my mode of action with iodine has been, you'll see things that have very different assays. And because my goal is to help someone get to a safe range, I'll say, look, let's be cautious. So if things occasionally have high amounts, I think that's worth taking into account and working around. So those can be big sources of that. And thankfully, yeah, there's a lot of good salts that don't have it.
Somebody here is asking about, I didn't ask you about this, but this is a really important question. Do MRIs expose you to iodine? There's certain medical procedures that can cause a huge exposure. Can you share maybe more about that?
Yeah. So not so much the imaging itself, but contrast agents. In many cases, iodine is used as a contrast agent. And it's kind of curious. There's versions of iodine used with those that are cleared rather rapidly. There are versions that often the body can clear. Not everyone can clear as others, though. And sometimes they can stay in the body longer term and be problematic. But yes, if someone does have thyroid disease, it's worth talking about what kind of contrast is proposed if they're going to get an MRI or a CT with contrast.
Yeah, I feel like that's such a key important thing to share, because I know I've seen countless people who really had significant challenges after having that iodine contrast done. And I've had an MRI, but they didn't use contrast, so that isn't something that the MRI doesn't in itself cause it, right?
Yeah, the next big medical source would be amiodarone, not a commonly used medication, but we talked about 200 micrograms being a safe upper limit. So each tablet of amiodarone is usually 250 milligrams. So it's a lot. And it causes so much damage. It's never given without there being a lot of thought and without a few other options. So no one ever takes it lightly to prescribe it. But it has a long list of side effects that can come on 6 months after someone has used it. And most of those equate to the high amount of iodine in it.
Yeah, I remember learning about that one in pharmacy school, and it was like monitor thyroid function, monitor thyroid function. It was like a really big deal with it, where because of that high iodine content, it can be very problematic for some people. In my experience, I've also seen people who are like, oh, I'm just going to eat a whole bunch of seaweed snacks, or they take those, I want to say, is it called Lugol's or some other high dose iodine liquid, where they essentially hear that they're like, it's going to help boost your energy. And at first it can, but then within a period of taking it, they might feel a crash and they feel significantly worse. So I've seen some people, inadvertently like overdose themselves. Do you have like if somebody is in that, we talked about kind of people that are on an average daily exposure of iodine, and this plan can work really well for them just to reduce their overall total load. What about people who maybe like megadosed on iodine? What do you do for them? Do you have something that you recommend that they follow? In the past, I've just been like, okay, we're not going to do that, and we're going to follow a low dose iodine protocol at this point, right?
The thing is, the body can't clear a lot of iodine above a certain threshold. So most of it is cleared through our kidneys. Some, when we get exposed to a lot, some is also cleared through the biliary routes and the stool and the sweat. But those things all have limitations. And then what happens is, within the thyroid, there are the proteins that store iodine, thyroglobulin mostly. And each molecule has designated spots for about 13 iodine atoms, but there's about 60 areas that it can end up. I think about you see like the clown car, all the clowns roll out. So there's not that many seats in the car, right? But there was a whole lot of clowns in there. So that's like too much iodine on thyroglobulin. It's no longer in the seats, it's spilled over. And the thyroid gets rid of iodine by making hormone and by releasing hormone. There's only a speck of iodine that goes out through non-hormonal mechanisms. It's almost negligible. So when you're not making a lot of hormone or you're on medication, iodine doesn't leave your thyroid very fast. It's mostly staying there. And so if your daily intake is above some threshold, you may stay at an excess for quite some time. And it's only when you can get your intake below a threshold to where you can make a gradient that you can start clearing it. And if there's been really high exposure, you mentioned some great things, some super important nutrients like selenium and zinc and iron. Make sure those things are all in appropriate levels. Lacking those, then all of your iodine regulating enzymes, the deiodinase enzymes, only work more poorly. So those can help things work to a normal optimal level. There's no way to rapid fire it out though, other than just time and yeah.
Yeah, that can be quite tricky. I know a lot of times for people that have had those really high doses of exposure, the tincture of time is what you need to really work through that process. A lot of the research on selenium, when I was writing my book, Hashimoto's the Root Cause, I just spent a lot of time on selenium. It's a very, very important thyroid nutrient. And again, it's also one of those narrow therapeutic index nutrients. And that can work really well in synergy with selenium. And I remember seeing that people who were selenium deficient were more likely to have adverse reactions to iodine. Has that been your experience as well? I know I typically, for most people that I work with, selenium is one of the nutrients that comes up for me as something to potentially consider if I see elevated thyroid antibodies.
Couldn't agree more. Yeah. So people have their genetic iodine window, and the genes making someone prone to thyroid disease make the top of that window a little lower. And then to compound that, if someone has certain nutrient deficiencies, that can narrow it further. So you can only expand your window so much, but if you're lacking things, that gets tighter. There are some who argue that iodine is harmless with enough selenium, just not true. Kind of the fun thing about selenium, there was there's often concern about getting excess from dietary sources. So a couple of weird things. There's paradise nuts and Brazil nuts. Now, paradise nuts are not commonly on the market in North America, so almost never come across them. Brazil nuts are. There was a study done in Brazil, and honestly, if they had asked me to approve the study, I don't think it was ethical to have done in the first place, but they did it. What they did was they wanted to see if the selenium in Brazil nuts could become toxic at some threshold. So they gave it to preschoolers, like a lot. Like these preschoolers, they were consuming about 20% of their caloric intake from Brazil nuts. And this was done for 3 months. There was a similar cohort of kids who were on more common diets. Now, another wrinkle, these were kids that were rather nutritionally poor. They were somewhat malnourished. So if someone's apt to have a problem show up, it's even more likely when they're not at a full state nutritionally. Now, they did do a lot of tracking. They tracked many markers of selenium's function, such as glutathione, selenium status, such as serum selenium, and selenium excretion, like selenium in the hair and the nails. And what they saw is that the kids who were back up to the count, if you were thinking of like an adult dose, it was about 30 to 40 Brazil nuts per day for a comparison to what it would be for an adult. Is that how much these kids were doing for 3 months? And the amount of selenium in Brazil nuts can vary tremendously from time to time and batch to batch. Totally true. Now, these kids, in terms of their general health and overall scores of health and vitality, they end up being better than the cohort peers they were compared against. Their glutathione status was fine. Their serum selenium was fine. Their selenium excretion was very high. They had a lot in their hair and their nails. And this has led many to believe that the versions of selenium metabolites in Brazil nuts are ones that the body can excrete more readily. So I don't think it's likely to overdose on them with reasonable intakes, because in that extreme scenario, the kids didn't even overdose then.
Yeah, I'm not going to give my 6-year-old 30 Brazil nuts, but
I wouldn't encourage them.
That is encouraging. I feel like Brazil nuts are something that are a great source of selenium. In my experience, I haven't seen them move the needle as much as I have with selenium supplements per se, but that's encouraging that we can still enjoy them without worrying about like overdosing on them.
It's fascinating. So selenium works in different ways. So it's part of the diet and it's used as a nutritional cofactor, but it also has effects that are non-nutritional, that are pharmacologic. So yes, supplementation works in ways that are parallel to dietary selenium. And dietary selenium, its benefits are more correlated with the degree to which someone is lacking in selenium. If they're low, it'll help, but if not. But independently of that, selenium can have pharmacologic effects that are often useful.
Mm-hmm. Yeah, it's been so interesting to learn about nutrients and how they can be used to replenish deficiency, and also that they can also take on other kinds of like pharmacological properties. And selenium is one too. When you do use it as a nutrient, typically I don't like seeing it above like 400 micrograms, because you can actually become selenium toxic when you do take it as a nutrient. So just kind of a caveat for everybody listening, like with a lot of these things we're talking about, more is not necessarily merrier. We do want to make sure that they are in range.
Did I ever tell you that I've seen that before, selenosis? I've diagnosed that before.
Yeah, tell me more about that. I know there was a compounding pharmacy that like didn't do their math correctly, and there was like a big incidence of that. I want to say on like show horses or something.
There was a case in humans too. This was about I think 15 years or so ago, where it was kind of a supplement manufacturer made it incorrectly, so that happened. But in the later 90s, when antioxidants were more in vogue, there was a lot of antioxidant products that would include selenium, vitamin C, vitamin A, zinc. And a patient of mine was taking, it ended up being about 1,000 micrograms per day, but I didn't know that was the culprit at all. He had a lot of vague malaise type symptoms. He had rather unusual findings on his blood count. He was starting to see some hair loss. And on physical exam, he had, this is a funny thing we learned in medical school, a gingival stippling. He had blue lines on his gums. And I saw that, and I remembered that was often a sign of lead poisoning. And also that did fit the abnormalities on his blood count. That's what I was really suspecting. And just by stupid luck, the test that I did, which also showed his lead levels, happened to show his RBC amounts of selenium. And lead was fine, but selenium was like 50 times above range. It was way, way off. And then I went through everything he was taking more thoroughly, like, oh wow. So we had him, the prescription was knock it off, don't do that. And, and his scores came down and things went away. But it looks a lot like lead poisoning. And yes, it can happen.
Yeah, I haven't had any clients with selenium toxicity, but I have had some readers writing into me and saying that they were taking selenium supplements for a long time and that they ended up essentially having levels that were too high. And hair loss is one of the symptoms. In my experience, and just trying to ask more questions, I think some of them had the CBS gene mutation, and that can perhaps increase that likelihood, and maybe I want to say maybe some issues with like sulfur absorption, and perhaps they were taking a few other things. But I have seen people writing in about this. And generally speaking, like I feel like, again, this is something that you want to really monitor and be mindful of when you are utilizing nutrients. I did want to ask you about this. When you have somebody on the low iodine protocol, what markers are you measuring? We talked a little bit about TSH. So you're actually seeing that TSH going down for people. Are there other markers that you're looking out for to make sure things are moving in the right direction, that they're benefiting from the protocol?
Sure, thyroid hormones, thyroid antibodies, markers of thyroid inflammation are relevant. The curious thing is that there's a narrow context in which iodine tests are helpful. They're often, tests, they're not predictive to see who would benefit or not. You would think that you could just do a test and say, oh, I'm high, this will help, or, well, I'm low or normal, I shouldn't bother with this. It's not like that. So there are definitely, if someone is really high, that can be a problem. But even those who are not high sometimes still benefit by reducing. And that's because what's happening within the thyroid is not the same as what we see in the blood or in the urine. So the one time they can help is if someone has been doing the approach for a while and not sure if they're seeing clear benefits. In that case, they can then test urinary iodine to creatinine ratios and get a ballpark idea on whether they're at a therapeutic level or not. You mentioned those who might have consumed really high amounts from drops or whatnot. Yeah, in those cases, they can see if they've cleared it and got down to a range just yet or not.
Mm-hmm. That makes sense. Thank you for sharing that. What about like in terms of thinking about, I know with certain nutrients or protocols, I'm like, let's say if I have a person with multiple chemical sensitivities, that I'm like, okay, you're going to really benefit from liver support. If I have a person that's just like super, super irritable and burned out, I'm like, okay, let's focus on your adrenals. And there's other people where I'm like, yeah, this might be too much for you. And like, we're not going to go there with you just yet. Do you have any kind of people like that when you see them where you're like, this would be a really good fit for a low iodine protocol? Or you would be like, yeah, let's not do that right now with you. Like, do you have any like patient profiles or categories that you would put into those buckets?
The difficulty is that for probably about 25 years, no one has seen me that doesn't have thyroid disease. So yeah, no kidding. So that's what it's for. That's what it's helpful for. And in terms of efficacy, to date, I've not seen studies of any other intervention actually reversing thyroid disease. And I wish we had more studies. The studies aren't perfect. But yeah, not all things work for all people. But to date, I've never seen other interventions like fully reverse it once it's established. So yeah, I think diet is a big factor and a good place to start. And if someone's already on a diet of some sort, that's great, but I'm going to encourage them to do it in a way to where they're also taking their iodine into account.
Mm-hmm. Yeah, I think that's such great advice. I think the only studies that I've come across were in subclinical hypothyroidism, not like in overt hypothyroidism. And those were like celiac, or if you're celiac, gluten-free diet, and then and then the myo-inositol, selenium, and vitamin D for some people, but it's not like
those have improved markers. I've seen studies showing some improvement, but I've not seen studies of those showing reversal of disease.
Okay, so are you seeing like zero thyroid antibodies as well, and then like just completely normal TSH, like around 1 with the low iodine protocol?
Quite commonly, and I wouldn't say 1 being a mandatory target, but there's also published studies on overt hypothyroidism, 60% reversal for adults with overt hypothyroidism, multiple studies on subclinical to where we're seeing, between first study, 50 to 70% reversal with subclinical. So yeah, like full on disease reversal.
I think that gives a lot of hope, and this is a really, really exciting protocol. What I don't want people doing is like throwing their thyroid meds in the trash and being like, I'm going to start this tomorrow. Can we talk
For
about
sure.
if somebody is already on thyroid meds? Maybe they've had thyroid disease for 5, 10, 15, 20 years. They're already on a pretty high dose. How would they, if they were, they had hopes of coming off of their meds and managing things naturally, how would they think about the process? Like what would you caution them to do?
There's been a couple of good studies done on the idea of deprescribing. People
Yeah.
are put on medications, but there's not normally a process by which they're taken off. If you start on something, you often end up staying on that. So some of the studies, actually, I'm sorry, all of them have a mixture of people who, most of whom were probably subclinical or normal, but perhaps not optimal. But then also many were overt. Their thyroid really was shutting down. It's funny, but what we call subclinical hypothyroidism is actually not hypothyroidism. There's not a lack of thyroid hormone. There's a risk for that happening, but it hasn't happened just yet. Yeah, at overt hypothyroidism, now the thyroid is decompensating and it's really shutting down. So the studies I'm going to mention, there's a mix of people like that. And in them, they've shown that about 84% can successfully lower the dose of meds with no negative changes to symptoms or levels. And about half of that cohort can come off. Now, some of the more recent ones have also added in iodine regulation. Basically, it's talking about some of the bigger outlying sources of iodine, having them avoid those. But they've shown that, yeah, many can reduce. And the studies that I'm alluding to really haven't been done with other elaborate facets of care. They're not saying, hey, let's make sure your adrenals are healthy. Let's do X, Y, and Z. It's pretty much, here's your meds, here's a table schedule, have at it. There's really not a lot more than that that's done. And even with that little involvement, many people can do fine on less. But it is something that you do need supervision with. It does take some monitoring. And yeah.
Yeah, thank you so much for sharing that. I think generally speaking, working with a practitioner and then testing your numbers and looking out for your symptoms to make sure that you're tolerating the dosage reductions is a great point. Do you have perhaps like a increment that you might recommend for a person to think about? Like, because I know I've seen people that were like, I'm going to cut my meds in half tomorrow. And I'm like, well, maybe that's not the best idea, right?
It's kind of shocking, but some of the recent papers were aggressive. We're doing it over only several weeks. Most studies to date have done a 2-month time frame. So basically a 25% reduction every other week for 8 weeks has been most typical. But there's a lot of art and science to that. And it's important to work with someone who really understands that process. A really common pitfall is someone will say they want to quit. Their doctor is on board with the idea, but maybe not experienced with it. And then the doctor will test them right during their taper and see, oh, well, their TSH has gone up. Oh, you can't do this. Well, that's normal. That's supposed to happen. That's part of how your body gets your thyroid going again. So it does really take understanding how things look and how the scores, what to test when, and what it's going to look like at different time frames.
Yeah, I mean, that makes sense because your TSH will signal your brain to make more thyroid hormone. But the question is your thyroid going to be able to meet that demand? And if it is, then that's a good thing. And if it's not, then then that may be a conversation for like, hey, this maybe didn't work. How much time do you give the TSH to optimize with like a dosage reduction? Like what would you recommend? Because like you said, some doctors might be like, oh, this ain't working. Let's go back to, the drawing board, right?
Yeah. If someone is actually off of medications, it can be 6 months to reach a full baseline again. Thankfully, T3 and T4 levels can be assessed and understood in a shorter time frame, and you can still see how the thyroid is performing, but it can take some time for the TSH to level out.
That's amazing. Thank you so much for sharing that. I know there are people that have been interested in getting off of thyroid medications, and I've never really had a great answer for them before, where I've just been like, for some people this can happen and we do it very gradually, and I'd recommend doing it very gradually and slowly with time. But this is like a protocol that you've been perfecting over the last few years and testing. So I really appreciate you sharing it with us. For people that maybe want to learn more about this or how they could work with you, and I know you've also trained some practitioners on this, can you give them a little bit more information?
Sure, easiest resource would just be drchristiansen.com. I've got quite a bit of information there about lots of free blogs on deprescribing, and there's a digital program that guides people through the process as well. But yeah, there's information available, and it's something that um, currently I think my record is 45 years. Someone who was on medication for 45 years that is now on none and totally stable. So you'll hear things talking about certain time frames, certain diagnoses, and really the more someone is doing the kind of things that you're teaching them about, and the more thorough they are with their health, the better their odds are.
That's really, really fascinating. And just to clarify, I think I maybe have asked, but does this protocol also lower thyroid antibodies, or do you expect to see them staying the same or going higher when you do this protocol?
No, in nearly all cases, they come down. And that's the consensus now, is that medication use doesn't have a big effect on antibodies in nearly all cases. So the antibodies are so important. They affect a lot of health and many symptoms, regardless of thyroid levels. But meds don't often do much for them, good or bad.
Okay. And the low iodine approach, does it lower the thyroid antibodies too?
Well, yeah, again, so thyroid peroxidase, it's the enzyme that oxidizes iodine, and thyroid globulin is a protein that stores it. So they're all about iodine. So when it's lowered, they come down. For most people, by pretty dramatic amounts.
I have a theory that thyroglobulin antibodies might be, I always kind of had this theory that thyroglobulin antibodies might be related to iodine overdose and just like toxicity in general. I don't know if you've had any kind of, I don't know, thoughts on that.
There's a lot of good data about thyroid globulin antibodies specifically being affected by things apart from thyroid autoimmunity. So they can be non-specific related to inflammatory change, other autoimmune diseases, chronic infections, also thyroid volume. We've got thyroid globulin and antithyroid globulin, but thyroid volume can also skew antithyroid globulin. So yeah, other things can affect it as well.
Yeah, really, really interesting stuff. You're actually providing a free iodine food list for people listening today. So I'm going to be linking that to the show notes. Thank you so much for providing that for us. That's going to be incredibly helpful because like you said, it's like kind of hard to track down this information, but you actually have tracked it down for us. So we really appreciate that. The other thing, I'm going to ask you some fun rapid fire questions, but before that, some of our listeners have some really, really great questions here. So do you have a few minutes to answer them?
I'd love to.
Okay, great. Thank you so much. Let's see. We have, let's see here, some really good ones here. Cynthia says hello to you both. Claire says two fantastic doctors. Let's see. Been on a high end of selenium for years. Enough, took out all the supplements that included them. Also no Brazil nuts. Thanks so much for sharing. Somebody is asking about what do you do if you're limiting iodized salt because of hypertension, longtime former Graves' disease and treated with radioactive iodine twice, taking Synthroid for years.
Well, if you're limiting salt for hypertension, it's not a problem to limit iodized salt. That's yeah, not a problem. Yeah. If you're doing a non-iodine, low iodine, non-iodine salt, like kosher salts, it's still salt, and you still want to consider your salt intake and your salt needs. But yeah, so yeah, no problems that way.
Natalie says, do you have patients that their ultrasound results change to no more autoimmune picture and enlarged lymph nodes after low iodine diet? That's such a great question. I know you're a big advocate for thyroid ultrasounds.
Structural change is quite commonly, and large lymph nodes are not usual with thyroid disease. That's something good to make sense out of for a lot of reasons. But as far as structural changes to the thyroid itself, that's quite common, yes. And actually many people with autoimmune thyroid disease only have findings in ultrasound and don't have the findings in the blood markers. We call that seronegative Hashimoto's. But yes, thyroid structure often improves. And along those lines, thyroid nodules quite commonly improve from the same approach as well.
Yeah, I was going to ask if this approach would be helpful for thyroid nodules as well.
For many, it is. So the documents, data we have on things that affect thyroid nodules, regulating iodine, weight loss if it's appropriate. There's a lot of data saying that when someone has hyperinsulinemia, they're more apt to have nodule growth than they would otherwise. There's also a handful of different nutraceuticals shown to help help the odds of nodules decreasing over time.
Mm-hmm. Okay, Swimming Lessons asked about the gene mutation that I mentioned. So it was the CBS gene mutation. Arlene, I think I know what you're going to say to this, but thoughts on sprinkling organic sea kelp or dulse on eggs almost daily?
So I guess the point of the discussion was too much iodine can be a problem. So that could be a problem.
All three of those. So we didn't really talk about eggs, but eggs can
Yeah.
be a high source of iodine in the yolks.
Yeah, so funny thing. So some sources that have a lot, like highly processed foods, processed grains, no harm to get rid of. There's not a lot you're missing, really. There are other foods, and I encourage the most strict reduction for planned periods of time. They don't have to be forever. It shouldn't be forever. And I call that the reset stage of the thyroid reset diet. I broke the foods down into green light, yellow light, and red light. And so the reset stage is all green light foods. But there's some foods that are moderate in iodine that are really nice foods for a lot of reasons. And egg yolks are on the top of that list, and also many types of seafood. So I love it when someone has gone through the changes they want, their antibodies are down, they're no longer needing meds. And then I'm the first to say, hey, add in a couple of yellow light foods. Egg yolks are wonderful options to put back in.
On that note, somebody was asking about, is there a resource to track how much iodine we consume in foods? MyFitnessPal allows to track some micronutrients, but not iodine.
Iodineinventory.com. I made that. You can plug in your foods, plug in categories, your meds or whatnot, and supplements, and get a pretty good gauge about your intake. And that's the thing. You can't really measure what's in your body per se, but you can take an inventory of what you're ingesting. There really aren't known human variations of iodine absorption. So what you intake is what you are assimilating. So yeah, iodineinventory.com is an easy way.
Thank you so much for sharing that and for creating an app for us. You also created a documentary, and it's invisibleiodine.com. Can you tell us a little bit more about that?
It's the whole story. It's something that we don't think about, but it's been a big driver of thyroid disease. And the correlation of iodine increasing in the diets has correlated with the rates of many types of thyroid disease going up. But the positive message is that most people can get to a low threshold and reverse the problem. So this really talks about just all the data around how these things have changed, over what time period they've changed, some of the hidden sources of that, and how you can be more aware of it all.
Thank you. I'm going to add both of those to the show notes. Thank you so much for everything that you do for the thyroid community. Now I'm going to put you on the spot a little bit. What's a wellness hack that you refuse to participate in?
It's funny. At some point in time, I've done almost anything you can imagine. Everything extreme. I've tried all of it. At this point, I won't do extreme diets anymore. I've done enough. I like to have a wide range of healthy foods in good enough amounts. So that's just it. Is I won't do extreme food eliminations anymore.
Been there, done that, right?
Been
there, done that. Wrote the book.
Well, not everything is healthy for all people, for sure. And I don't consume all things, but yeah, I don't like going on super narrow diets anymore.
Mm-hmm. Most outlandish thing you've ever tried for your health?
So now this will help you understand why I don't want to do extreme diets anymore. So in trying everything, I once ran some version of a alternative cancer treatment protocol, and I followed it in writing a paper on it in medical school. So for 2 weeks, I lived on raw liver and raw collard greens, nothing else. And I put them in a blender and blended it up and choked it down, and that was it. Now, there's not a lot of foods that I don't like, but I still can't stomach collard greens. They're great foods, but ever since then, I'm like, nope, I can't. That's like the only thing I can't do.
I think I need to send you like a medal, because I think this is the most extreme thing that anybody has done.
So there's one more bad level. This was in medical school. I was a starving student. I was broke. I had a crappy old cheap blender. It didn't even blend it up very good. It was all chunky. It was so bad.
Oh man. I'm gonna try to get that out of my mind.
Yeah. Do not try that at home. There's no reason to.
Your personal routine. If you had the supplement police come to your house and say, I'm going to take away all of your supplements, but you can keep one, what would that be?
Boy, if it's just one, probably vitamin D. I'm pretty fair complected. I'm in the north. We don't see a lot of sun that often, and I need to do without that one entirely.
Yeah, a lot of my friends in like the northern hemisphere and in Canada have said that. Nobody in Texas has mentioned vitamin D. Do you have any guilty pleasures that are not like doctor approved? Maybe somebody would see you and they'd be like, is that Dr. Alan Christensen? Is he really doing that?
You've known me for quite a while. Nothing all that interesting. I do endurance races sometimes, and the days before those, it's funny because you need a certain amount of calories, certain amount of carbohydrate, and you can't do a lot of fiber. You can't just be filling up on whole food carbohydrates, or you're going to be, spending a lot more time in the rest stops than you want to do on your race. So it's all fiber-free, super high carb foods. So I'll make Rice Krispie treats. I'll do a lot of those. That's kind of an easy thing to get down. That won't bother my stomach in high amounts, or tons and tons of white rice. So during those times, that's probably the closest thing. Apart from that, probably my biggest guilty pleasure is there's some really good NA beers nowadays, and I really love those. So I'll have several a week. And
yeah, when in Minnesota, like when in the Midwest, you've got to have your beers, right?
Well, they're doing more non-alcoholic versions. Yeah, that's the NA part.
And I have to tell everybody, so Dr. Christensen, if you ever go to a costume party with him, just be prepared. Like, bring a camera. He is like so fun and so hilarious. And I mean, I've been at like wellness conferences and functional medicine conferences with him where somebody decides to have a costume party, and Dr. Christensen always takes it to the next level. I know, like one year you came as Borat.
I've got a picture of you, and you're doing something kind of like this. Eyes are this big.
Oh my gosh.
Covered up.
That sounds about right. Like maybe we can use that. Do you have that picture? Maybe we can use it for promoting this episode.
I think I can find it somewhere.
Thank you so much, Dr. Christensen. This has been so fun picking your brain. I'm so excited to learn about your low iodine protocol, and so excited to share this with people because I feel like there's so many people that really want to do things the natural way, and they're wondering if there's anything they can utilize to get off of thyroid meds and really optimize their thyroid function. And for some individuals, this could actually be a key. And in a sea of like everybody talking about high iodine, I feel like you're actually showing that this different approach can work really, really well. And you have so much experience and evidence to back this up. And I really, really appreciate you coming out with this approach. And your book, Thyroid Reset Diet, is where people can get the whole protocol if they wanted to perhaps learn more about that. Is that right?
It's all there. Yep. Recipes, meal plans, the whole story, lots of the science if you want it. And yeah.
Perfect. Thank you so much for taking the time to connect with us. And for everybody listening, I hope that this has been a healing part of your journey. Until next time.